Ladies and gentlemen, welcome. Hello. Hi, my name is Kevin Coombs, and I'm the Assistant Dean Research in the Max Rady College of Health Sciences, Faculty of Health Sciences, here at the University of Manitoba. I'm pleased to be your Master of Ceremonies today for this very important announcement. I'd like to begin by acknowledging that the University of Manitoba campuses are located on original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. We respect the treaties that were made on these territories, we acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. I would like to take this opportunity to introduce our speakers today. Member of Parliament for Winnipeg Centre, Dr. Robert Falcon-Ouellette, here on the right. College of Medicine alumnus, Dr. Doug Eyolfson, Member of Parliament for Charleswood, St. James, Assiniboia, Headingley. Dr. Josée Lavoie, Professor, Department of Community Health Sciences and Director of the Manitoba First Nations Centre for Aboriginal Health Research, University of Manitoba, and Dr. Dig Vergias, Vice President, Research and International. I now invite Member of Parliament Ouellette to say a few words.
Mais merci beaucoup, c'est extrêmement un grand plaisir pour moi d'être ici sur le territoire de traité numéro 1, le territoire traditionnel et la patrie des peuples Anishinaabe, également Nehio, Cree, Dakota, Oji-Cree, également la place où les nations métisses étaient nées ici sur ce territoire. Et aussi c'est également votre maison à toutes nous autres, tous les Canadiens, c'est notre maison, on en vit ici ensemble. I'd just like to say we are here on Treaty 1 territory, homeland of the Cree, Oji-Cree, Dakota peoples, Anishinaabe peoples, as well as the homeland of the Métis Nation, and also it's also your home. And I hope you never forget that, because we all live here together. I'm really proud to be here to have the opportunity of introducing my very good friend, Doug Eyolfson. Dr. Eyolfson is a very hard worker in Parliament, and I think I'm very proud to come here back to the University of Manitoba, where I was a professor and an academic back on the Fort Garry campus for a number of years. I had the opportunity of earning a couple of SHIRK grants, one in the partnership and one in the Insight grants, and I know how difficult it is to obtain funding in these funding streams. These are peer reviewed, and people watching online or who are going to be watching on Facebook, sometimes they don't know what peer review is. It is where our colleagues, other researchers who aren't in that competition, are then evaluating your research according to a set criteria, and they come up with a score, and eventually they decide who will receive funding and who will not receive funding. It's very competitive in order to receive that funding. So I'm very proud to be here to acknowledge those researchers who have been able to succeed so well. And I only hope that Manitoba, because we did receive a little less funding than the national average, I hope other researchers will start going out and looking at opportunities. I know it's very difficult to do here in Manitoba because we are sometimes far away from the major centers like Toronto and Montreal and in Quebec City and out in BC. But at the same time, I think we have to push and drive ourselves to excellence because we do have really great and excellent researchers here. And it's time that we try and obtain that funding so that we can reach that national average and even succeed or surpass it. So without further ado, I'm going to introduce my friend, Dr. Doug Eyolfson, who is one of the finest colleagues that I have to know. He's a true gentleman in the House of Commons. We don't have many like him. Often they sometimes say it's a bit of a childish place, but nonetheless, there is a gentleman that resides in that place, the House, and his name is Doug Eyolfson, and I'm very proud to call him a colleague. I often look to him and I think, if he's acting like this, I should act like this, and I try to emulate him as much as I possibly can. He's got a quiet persona, but always very forceful when the need be, and he always speaks with force for his constituents and the people of Manitoba and Winnipeg. And so I'd just like to have Doug Eyolfson come up and make the actual official announcement.
Okay, thank you, Robert, for those very kind words. It's very good to be back here. This place has been a big part of my life. I actually started working on a master's here in 1984. I spent a number of years doing medical research just over in the basic medical sciences building here. Did a year of a PhD, also did medical school and residency here. So, and I worked for the last 8 years before I was elected at the emergency department of this hospital. So a lot of fond memories of this place, and it's good to be back in this capacity. Okay. So it's a pleasure to be here on behalf of my colleague, Minister of Health, Jeanette Petitpas-Taylor. The University of Manitoba is home to many talented and hardworking researchers, professors, and students. It's an institution that always makes Winnipeg proud. Canada is blessed to have so many world-class scientists, many of whom are located right here at the University of Manitoba. And that's why I'm here today to deliver some great news for our community. Our government proudly supports science. We believe that scientific discovery holds the key to finding solutions to many of the economic, social, and health challenges we face as a nation. It's thanks to the imaginations of many of you in the audience today, scientists and researchers, men and women with a curiosity to explore the unknown and a passion to improve the world, that we're able to approach old problems in new and creative ways. The Canadian Institute of Health Research, or CIHR, supports this blue sky thinking through the Project Grants Competition, our largest funding program. Today, I'm very pleased to announce that the Government of Canada is investing $9.7 million in health research in the province of Manitoba. Money that will be coming right here to the University of Manitoba and to the St. Boniface General Hospital Research Centre. This year's project grant competition will see a total investment of $372 million in over 500 research projects across the country, making this one of the single largest investments in health research that our government will make this year. These funds will support researchers working in every region of the country, across all pillars of science, and at every stage of their careers. They will also create high-quality, middle-class jobs for researchers, technicians, and trainees working in labs and research institutions. Health research is one of the most important investments that we can make as a nation. Investing in health research today leads to long-term cost savings, but most importantly, it also saves lives, leads to new treatments, scientific breakthroughs, and the new knowledge that is at the core of all health advances. As an emergency room physician with more than 2 decades of experience, I can attest to the fact that the ER is one of the places where issues with public health and safety become painfully evident. I have personally witnessed firsthand the effects of government policy on health and well-being of Canadians, and I can assure you this is a good news story. As a case in point, we are investing in 12 projects here at the university that tackle a full range of health issues, from kidney disease and spinal cord injuries to Indigenous health and HIV. The projects being funded today have the power to change lives. I was so impressed reading through the list of health research projects being funded here at the university. I'd like to commend Dr Josée Lavoie, a researcher who works on kidney health and care in rural and remote Manitoba First Nation communities. Manitoba First Nations have some of the highest recorded instances of end-stage kidney disease in Canada. But because they live in rural and remote locations, they can experience significant barriers to accessing care. Dr. Lavoie is going to use the funding she was received to work with the First Nations communities to understand how to improve kidney care for these communities. This is vital work. Another research team receiving funding today is Dr. Megan Azad. Dr. Azad's lab is doing cutting-edge research on the properties of breast milk and how they help shape the development of the immune system. She will use this funding to move forward her work exploring how a particular protein may help the development of allergies. Although I don't have time to mention each of your projects, know that I, along with so many other Canadians, am grateful to you all for your countless hours of study and hard work, and your commitment to improving the health of your fellow citizens and the quality of the Canadian healthcare system. On behalf of the Government of Canada, I wish to express my sincere gratitude to you all and extend my congratulations to the funded researchers here at the University of Manitoba. Thank you all.
Thank you, Dr. Eyolfson. Wonderful news. I'd now like to call on Dr. Jayas to say a few words on behalf of the University of Manitoba.
Thank you, Dr. Coombs. At the University of Manitoba, partnerships are of primary importance to us. Working collaboratively with our partners to find solutions to the real-world problems across disciplinary boundaries, our researchers create new and successful approaches. Thank you to the Government of Canada, our very strong partner in advancing the research and innovation enterprise of the University of Manitoba. Thank you to our MPs, Drs. Eyolfson and Dr. Ule, for the work on our behalf in Ottawa and for this wonderful news today. I would like to add my personal congratulations to today's recipients, those who are here today and those who could not attend this morning's announcement. 11 of the investigators are members of the Rady Faculty of Health Sciences. Dr. Megan Azad from Pediatrics and Child Health and Children's Hospital Research Institute of Manitoba. Dr. Sanjeev Dhingra, Physiology and St. Boniface Albertson Research Center. Dr. Michelle Drieger, Community Health Sciences. Dr. Keith Folk, Medical Microbiology. Dr. Andrew Hatala, Community Health Sciences. Dr. Sohila Karimi, Physiology. Dr. Josée Lavoie, Community Health Sciences. Dr. Neil Offer Mukherjee, Internal Medicine and Immunology. Dr. Thomas Muruka, Immunology. Dr. Catherine Sibley, Community Health Sciences, and George and Fei Yi Center for Healthcare Innovation, and Dr. Natalie Riedegger, Community Health Sciences. Two of the other successful investigators today are Dr. Joyce Slater, Food and Human Nutritional Sciences from the Faculty of Agricultural and Food Sciences, and Dr. Sean McKenna, Chemistry, Faculty of Science. All are the leading experts in their fields. In recognition of their highly competitive research programs, CIHR project grants competition, as MP Ule mentioned, how competitive the process is, what the process is involved. The funding you are receiving today is a testament to the high impact research you do at the University of Manitoba, and this funding would further your investigations and research. So I sincerely congratulate you on my behalf and on behalf of my administrative colleagues. I would like to recognize the many partners on these projects in addition to the federal government. I apologize at the beginning if I miss anybody because there are many partners when you are dealing with that many projects. These are partners from many of the community organizations and organizational partners who are supporting these projects. And these include, the first of all, Research Manitoba, our provincial partner, similar to the federal government partner, Spinal Cord Injury BC, Alberta Health Services, George and Fei Center for Healthcare Innovation, Seine River Physiotherapy, Toronto Rehabilitation Institute, University Health Network, British Columbia Support Unit, Rick Hansen Institute, Hamilton Health Sciences, Michael Smith Foundation for Health Research, University of Calgary, University of British Columbia Okanagan, University of Ottawa, Manitoba Métis Federation Health and Wellness Department, Diagnostic Services Manitoba, Aboriginal Health Opportunities, St. Boniface Albertson Research Center, Children's Hospital Research Institute of Manitoba, National Aboriginal Diabetes Association, Winnipeg Harvest, Aboriginal Youth Opportunities, Newcomers Employment and Education Development Services, Child Nutrition Council of Manitoba, many school divisions, Healthy Child Manitoba, Winnipeg Regional Health Authority, Manitoba Health, Seniors and Active Living, Manitoba Education and Training. As you can see, it takes that old saying that it takes the community to raise child. It takes a lot of partners to make research work. And we are very much appreciative of the contributions from our partners, and we sincerely thank them for the collaborations they have with our researchers in completing this, supporting these research programs and research teams. I wish you best to all of our investigators and look forward to hearing the results. Thank you. Merci. Miigwech.
Thank you, Digver. Our next speaker is one of today's recipients of this new CIHR funding, Dr. Josée Lavoie. José holds a BSc in Dietetics and Nutrition in 1986 and an MA in Medical Anthropology from McGill University. She also has a PhD in Health Policy and Financing from the London School of Hygiene and Tropical Medicine. Before beginning her research career, José spent 10 years working in indigenous-controlled health services in Nunavut, and northern Saskatchewan. José's program of research is located at the interface between policy and indigenous health services, with a focus on contracting accountability and responsiveness. She is particularly interested in how Western and indigenous knowledge systems interface in the provision of health services in indigenous communities. Please join me in welcoming Dr. Lavoie.
Well, good morning. It's a great honor to be able to address you this morning on the day of celebration. I'd like to begin my talk with thanking Dr. Eyolfson, Dr. Willett, for taking time away from your busy schedule and being here for this celebration, and Dr. Jayas, Dr. Coombs for their kind words. I have the privilege of being the director of Ongomazin Research, which is also known as the Center for Aboriginal Health Research, and since June 2017 has become integrated within the Indigenous Institute of Health and Healing. Ongomazin Research promotes partnership-based research with Indigenous communities and organizations and Indigenous movements across Canada, in Manitoba, and also globally. With over 60 members, Ongomazin Research is the largest such center in the country and is also the oldest. This morning we're celebrating the success of not one team but 4 teams affiliated with our center. Dr. Michelle Bridger will be leading a study entitled Changing the Patient PCP Dialogue, Fostering Trust Through Joint Clinical Decision Making, which was developed in partnership with the Manitoba Métis Federation's Health and Social Wellness Department and Diagnostic Services Manitoba, which is now transitioning into shared health services. So Michelle, is your team here? Can we see who is? Congratulations. Stand up. It's a party, guys. We're also celebrating the success of Dr. Andrew Hatala, who's an early career investigator, who will be leading a study entitled Pathways to Resilience and Health Equity, Participatory Action Research in Indigenous Youth in 4 urban Canadian contexts. And this study was developed in partnership with New Direction for Children and Youth in Manitoba, and also with Aboriginal Youth Opportunities, who so happen to be here. So guys, make some noise. Thank you for being here. This study is also being implemented in 3 other centers, Thunder Bay, Halifax, and Saskatoon. Dr. Natalie Rittiger will be leading a study entitled Sticky Money, exploring the acceptability of a sugar-sweetened beverage tax among Canadian Indigenous population. And this study has been developed in partnership with the National Aboriginal Diabetes Association, Aboriginal Youth Opportunities, and also the 4 Arrow Health Authority. Is your team here, Nat? Hi, over there. And now for the next 5 years, I will have the privilege of co-leading an outstanding teams of researchers with Caroline Chartrand from the Diabetes Integration Program from the none other way WICAMIC, which is also known as the Health and Social Secretariat of the Assembly of Manitoba Chief, Lauren McLeod, who is also affiliated with the DIP program, and Dr. James Zacharias, who is right there. Thank you for being here. Who is a nephrologist with the Manitoba Renal program. Our team also includes researchers from the Manitoba Center for Health Policy, as Nathan Nichols at the back there, as well as Alan Katz, who is away right now. Service providers from the Manitoba Renal program, Dr. Commanda and Mrs. Natchuk, who is the dietitian on the program, and emerging researchers, Dr. Hallis, Dr. Ibrahim, those people are at the back, Dr. Keon Achan, Natalie Ridiger, second mention, and Dr. Leach. As was mentioned before, Manitoba First Nations have the highest rate of end-stage renal disease in Canada. This to us represents simply a failure of primary health care in being able to help a First Nation prevent the development of end-stage renal disease and its progression. Over the next 5 years, we will focus on improving responsiveness across the continuum of kidney care in rural and remote communities, First Nation communities, We will use health administrative data from the Manitoba Center for Health Policy to understand why is it that First Nations still today, and this is disproportionately First Nation, show up to the Manitoba Renal Program having no knowledge that their kidneys were failing and being in end-stage disease, with having had no prevention effort or support in preventing the progression of their disease. We will also try to understand what type of care is provided to First Nation in rural remote communities, and why is this not resulting in preventive care. This knowledge will be used to support the development of more effective prevention strategies and management strategies, as well as more appropriate treatment strategies in rural and remote communities. So this is a big task, and we're excited to be able to take it on. I'd like to end by thanking the Canadian Institute of Health Research, our funder, and by underscoring the role, the transformative role of the Institute of Aboriginal People's Health, who, as some of you may know, exists because of a position paper that was created in this university when CIHR was being created. It's because of activism from this university that we were able to convince the Government of Canada to create an Institute of Aboriginal People's Health, and this is also unique in the world. The historical leadership of the University of Manitoba researchers in partnership with Indigenous communities has been transformative of Indigenous health research across Canada for decades, and we should not forget that. So the Institute of Aboriginal People's Health today demonstrates its strong support for meaningful partnership with Indigenous communities. And we know, and I'm definitely convinced, and our research teams that are affiliated with the center know, that this is the only way to address health inequities in First Nation, Métis, and Inuit communities. Thank you for your time.
Thank you, Jose. I'd also like to add my thanks to the Government of Canada, to the Drs. Ouellette and Dr. Eyolfson for taking time out of their schedules to be here today, and to the many partners and research teams who have contributed to this success. This brings us to the close of the formal portion of the program. I would ask that the platform party and the recipients of the awards come up to the front for a photo opportunity. Dr. Sohaila Karimi, another recipient of a project grant, will be taking the speakers and media on a tour of her lab following these photos. And for everyone else, there are refreshments over here. Thank you very much.